And a warm welcome back to you all. Now, my next guest is a woman who is carrying forward the legacy of her mother, the legendary Dr. Zulekha Group, a true champion in healthcare. She is also taking her own business to new heights, making it one of the most visible and foremost names in healthcare in this region and beyond. So I'm absolutely delighted to welcome the co-chairperson of Zulekha Healthcare Group to us, joining us here at ABLF today. Please welcome Ms. Zanubia Shams. Great to see you.
Thank you. Thank you, Etna. Thank you, ABLF, for having me. Let's go on.
Well, it's great that you're here. And indeed, the focus on healthcare, without a doubt, I think if anything we have learned, maybe the hard way this year, is that, the health of the population is probably the most important element of our survival as an economy, indeed, as the world. So really, the healthcare industry is still really under pressure, even in the post-COVID world. How do you think professionals can actually manage from here
on? So I do think, I do think that some of the worst of this crisis is behind us. Now, going on ahead, there are going to be waves. So we are going to see problems in bits and pieces. But I think the significant challenge of 2020 was, what are we going to do? We know so much more than we did in, let's say, October 2019, when a lot of countries, segments of populations were just wondering what it means to have a pandemic, really. What does a pandemic even mean? What does that word actually imply? It's such a large word. I mean, it's, that what does that actually mean on the ground level? Now, a year plus on, we actually know what that means. We know that means, staying at home. That means basically being constrained, both in terms of our activities, which a lot of which are economic, and then social, and to some extent that has an emotional impact, and that has had an actual physical healthcare impact. The more restricted we've been able to be, the better off we've been. So this is what this year has taught us. Also, practically, it's taught us, what are the best ways of preventing the disease, keeping it at bay till such time that we're in a position to, be vaccinated. And so we've managed to get vaccinated here in the UAE. We're looking at vaccination percentages of between 50 and 60% of the population. The aim, I think, ultimately is about 70 to 80%, which is to achieve herd immunity. We've done some of that. Of course, UAE is an integrated global economy. So to that end, till the world doesn't come up to those vaccination levels, we're still at risk somewhat. So that's been the broader perspective here. The immediate perspective for us has been at once a slowdown in a lot of areas, and then specifically in certain specialities and areas there's been a kick up in and an increase in demand for our services. So it's kind of been, you have the wheels moving, but one wheel is spinning faster, unusually fast. One has slowed down considerably, and we've spent the last year aligning ourselves to those newer realities and newer ways of working and functioning. Everything from what infection control means to re-looking at the smaller aspects such as masking or washing hands or changing our protocols within operation theaters and so on and so forth.
That's so important. I was just going to, I want to build on that. When we look at, the Zulekha Health Group, you have hospitals, health centers, pharmacies. What have you been doing, as we've had, lockdown and look outside the UAE as well? I mean, what have you been doing to make sure, you mentioned some of them there, to make sure that everybody is safe and that we're getting through this?
Right. So a lot of things were already in place. We are, to state the obvious, we are a hospital. So a lot of the things that we are supposed to do, we have been doing. As I said, there is now an altered focus. And so we're talking about that change focus. You know, a lot of the way, for example, our outpatient services are conducted have changed a little bit. The way that we were thinking about operation theater functions or intensive care functions, those have altered a little bit. Just to give you a little perspective here, when COVID, when we first heard of COVID and when it came, in a serious way to the shores of the UAE, we had a lot of worry and doubt within ourselves. At the beginning, one of the discussions we had with our team was, should we be a COVID-free facility? And then you see, you have your own internal fears. Yes, we are a team, we're medical players, and we're a team made of medical professionals. And yet the unknowability of COVID, is it like a flu? Is it like a common cold? Could it pass without anything? We had to come to that point where we also understood that no, COVID is a reality. You can't pretend it away. You can't say, oh, we're going to be COVID free. There's no such thing as COVID free anymore. That is simply not going to be. So then, if we're not COVID free, then what are we? We are a hospital. We have to treat everybody who comes. If they're suffering from COVID, then we treat them for that. If they're suffering for COVID and for some emergency, let me give you an example. If, for example, you were to burst your appendix, okay? Now whether you're COVID positive or you're COVID negative, that problem, it's an emergency. So it has to be treated immediately. Now what do you do? Do you wait around for 2 weeks? No, of course you can't. So what do? You mask up, you glove up. How do you glove up in a protective way? How do you mask up in a protective way? How do you change the functioning of your OT? How do you protect your doctors, your nurses, your technicians? How best you protect them, and how do you save lives? Which is what our real business is. So it's been a learning experience. The data has come out slowly, and what should we do? What is essential? What was essential even in March of last year is now no longer considered essential. Yes. So we've learned so many things. We've implemented them, and a lot of these basics are the basics of infection control. So you know that.
You need that flexibility in place. But of course, workers around the world have, come under a lot of pressure, but I think no more so than anywhere. The pressure, I think, on healthcare workers has been huge. How do you actually manage to, keep morale up, and particularly in times of, of lockdown and of, those situations, that uncertainty? Who's caring for the carers, so to speak?
So it's been a struggle. At the beginning of the beginning, there was a lot of fear and anxiety. I do have to say, though, medical workers, and I want to start, from our staff who do a very essential thing like cleaning toilets and cleaning OTs and cleaning emergency rooms. Everybody has shown an amazing amount of courage. They've gone home and cried. I'm not saying that, but at a motivational level, they've really stepped up and they've been very motivated to help people. Sometimes they're angry. I am not saying that. They're upset, they're angry, they're scared. I mean, I've been scared when all of this started. I was scared to come to work, and I, kind of sit on the 12th floor of a building, and I'm not that exposed to patients. And I was wondering, should I touch the button of the lift? Should I do this? Should I do that? And but the frontline workers at Zulekha, and I believe in every healthcare institution across the world, have been incredibly courageous. Not when they've been working and they've been scared. Later, yes, they have. They've come to us. They've told us, look, we're concerned, we're fearful. They've gone home, and I think they've cried to their families. They've been worried for their families. All reasonable concerns, but not when it has come to the time of delivering a service. Have they given us a hard time over that? It's not like I'm not going to talk to this patient. I'm not going to visit a patient in his room. I'm not going to, time and time again, we've seen everybody from the basic housekeeping up to the highest specialist doctor say, I'll go first. Send me in. I'll take care. they're being concerned above and beyond themselves with the health and welfare of their our patients, of Zulekha's patients and their patients.
And indeed, I think, I'm thankfully I haven't had any emergency in a hospital, but I have been in and out of them. And I think, a big kudos to all of the workers and the front care health workers in hospitals. And I think they do it, with such great cheer to make sure that they might have fear, but they make sure that the patients don't.
Exactly. I just want to say this very same thing to you, that yes, they're scared. It's not that they're not. Because, how can you not? You're a human being. How can you not be scared? Every day you're seeing people struggling literally to breathe. And in a lot of cases, you wish you could just give your breath to them. Just a little bit, because you have so much you can breathe in. Just take a little bit and give it to them. And I've seen workers, our staff do that. Like, whether it's the receptionist, or like I said, the housekeeping staff, or of course the nurses, have kept everybody's mood up, have kept their cheer up beyond their fear. And it is a fear because, once in a year, we know so much more. We'll know what to do. We'll know exactly how transmission works. The data will be considerably more. But on very thin data at the beginning, which is, I'm talking about last year, on very, very thin data, people have had to, really utilize their hope and goodwill and cheer to get through this time.
Yes, indeed. Talk to me a little bit about how technology, here in 2021 has actually helped. If we look at this situation, what it could have been maybe 10 years ago, the fact that we are and all the hospitals are advanced in terms of use of technology and innovation. How has that helped?
All right. So, so let me talk for a second about in the context of COVID. One of the things that has been hugely beneficial to us has been the rapid transfer of data and information. Whether it's been our infection control teams, or it's been the Ministry of Health and Public Services, they've collected data quickly, they've gotten it out to us, they've been telling us, as soon as they know, they've been telling us that, look, these are the guidelines on so-and-so medicine, this is the guideline on hand hygiene, this is the guideline on masking, this is like this. Almost on a weekly basis, we've been getting updates on information. Whether if it is if you remember, there was a time when quinine was being spoken of as kind of like a magic drug of sorts, and then later the data showed no, that wasn't so, and Ministry of Health was very, very forthcoming in that. They were like, okay, we suggest you use it, we suggest you don't use it. They gave us approval to try different drugs, to try different therapies, and then once they had significant data, they were like, okay, look, no, this is not how it has to be done. This is how it has to be done. Also, the thing that has been, I think, very useful has been generally the fact that, so many of our own records, and I believe this to be true across the UAE, so many of our own records and data have been digitized. So it's been very easy to kind of for doctors to get a sense that, we're seeing this across 5 or 7 patients, we're seeing this across 10 patients, because you see, normally in another disease that would have, and another infectious disease, there have been much more data. But in this disease, there was a lot less data. So we've been working with very thin data. And it's been important to continuously collect that data and try to derive what broader significance you can from very light scientific data. Now that is its own challenge, and so the deviation within as you can imagine, is much higher. It's harder to draw conclusions, and yet much more important to draw some type of standardized conclusion that can go from helping a very small number, normally very small sample size that you wouldn't normally be able to use, to a broader sample size. So having data collection, having data crunching, having access to records, having like a broader ability to do that, rather than going manually through records or thinking I had so and so, and what did I do for that person, and what did I do for this person? It's all kind of coming together in a very small span of time.
And indeed, when we look at that data, I think, it has the efficiency that digitalization has brought into the industry. It's, you see it here when you visit a hospital or a clinic. They know everything from your phone number, from your Emirates ID, whatever it is. But then you look around the region and there are some countries, that are not as well off. And we look at, the SDG goal 3 on health in terms of, that equality of health distribution and the ability to make sure that health is available for everybody. That still is a big challenge, I think, in the healthcare industry. Would you agree?
Yes, very much so, very much so. And I do think that one of the important things that is happening here is that while healthcare is expanding its footprint, like there is more and more healthcare available. Like for example, in the UAE, has a reasonably. So I'll tell you the two regions in which I operate, so I can tell you what those issues are. The UAE is really like a developed country, which it is, not really like, but is actually a developed country. And then all the benefits of being a developed country do accrue to the UAE. For example, everything from, just starting right at the beginning, from good air quality to reasonably clean water to, clinical facilities being easily available, and having not to have an out-of-pocket expense, in the sense that because insurance is mandatory to a great extent in the UAE, health insurance is mandatory to a great extent in the UAE, it makes healthcare accessible without necessarily limiting those who are in deprived situations. As long as you hold a job in the UAE, there's a good chance you do have some type of health insurance covering you. There are, of course, exceptions to that, but those are not, the exception is the minority, not the majority. Now, if you go to a country like India, for example, India suffers from a basic infrastructure, a basic lack of infrastructure. And, what's happening is infrastructure is not getting added really the way it should at any level. Whether you speak about it at the higher segments or the middle segments or the lower segments. And, India has its own challenges. So I think a lot of our listeners today can imagine what kind of challenges a country like India might have. Now, India also does have some government schemes, central government schemes that allow people to utilize healthcare services and then can get compensated through those schemes. So there are those things available, but it is, I would still say at best, uneven and patchy. So there's a lot of work that has to be done, and that is a fundamental issue of infrastructure and manpower shortage.
Indeed, when we look at it too, it's something that I think, everybody has to take care of. I have a question from Muriel here, almost building on that one that just came in at the right time, but also asking, would it be important for developing countries to focus on perhaps incorporating overall wellness in their development mix when they look at the SDGs? Because perhaps it's not something, and I think the whole concept of healthcare is changing in the developed world, but, is it changing in the developing world?
So one of the very important things is access to primary care. And that really is the significant challenge in developing countries. How at a primary level, for example, you make sure that everybody gets their vaccination done, and how do you make sure that they get their, have access to the basic requirements that are needed. For example, India is struggling even with malnutrition.
Okay, I mean, again, this is something that not just India, I think we see other countries too.
But I only mention India to you because I think, it's something that I've seen up close, and I can at a level where, because the data comes to me, and I look at that because I am involved as an economic functionary in that particular region or in that country. So that's how I know.
Yes. Now, talk to me, let's bring this back to vaccine availability and the vaccine rollout. And again, what can leaders in healthcare actually do to, and also perhaps government and the private sector, and perhaps the need to work closer together to, make sure there is perhaps fairer and faster distribution.
So here's what I think. Right. I think the real challenge there was getting the vaccine ready. Okay, so you had to get the scientific data done, and then study that scientific data, and then put it all together and get an actual vaccine that works. Now we have several vaccines on the market, and those vaccines are coming with certain let me just put it politely, political baggage. But if we get beyond that, I think the difficult thing to do was creating the vaccine. That was the first step. Then the next difficult step was really, how do you ramp up production? And I think by and large, most countries have managed, or I should say, manufacturers really, we know now, have the capacity to ramp up production. I know that there is a discussion going on about which has become politicized, about how these vaccines are going to be distributed, who gets them, who doesn't. So I'm going to sidestep that issue for a bit, and I'm going to come to the next issue, which is, now that we know this is the vaccine, which we kind of know there are 3 or 4 different products on the market. There's Pfizer, there's Moderna, there's Johnson & Johnson, there's AstraZeneca. They all are coming with certain limitations, but by and large, every one of them is getting us there. Now, what we do know about the vaccine is, even if the vaccine, there are some vaccines that are not necessarily protecting people in as large numbers as they should. Like, you don't have an efficacy rate of maybe 90 or 95% in some of the vaccines. Fair enough. But what they are doing is they are limiting the impact of the disease and are helping people who even get COVID and who've been vaccinated and then subsequently get COVID. Also, they are helping those people fight off the disease and the symptoms, etc., in a much milder way. So I think that, generally speaking, the vaccines have achieved, if not everything that they were supposed to do, a lot of what they were supposed to do. So to that end, that's been done. The production is being ramped up. Now it's a matter of, like, how do you distribute it? We're seeing, for example, even in a country like the United States, where, once there has been a political will to do so, the ramping up of vaccine distribution has actually been fairly good. I mean, they've been ramping it up systematically. So we know there's a way to do it.
I think we've seen that in many countries around the world, and hopefully the other countries will learn for this. This is what has to happen. And I think it's great that many of the developing countries, and particularly here in the UAE,
So what happened with us was, I just want to give you a quick example here. When the UAE made this policy, this is sometime in December or late December and early January, that there had to be a mass rollout of vaccines. We approached the government, we approached the Department of Health, we approached the Ministry of Health. We told them, look, we are happy to be your partners in this distribution. One of the things that the government did tell us is, when you are distributing the vaccine, one of the things you cannot do is charge. You cannot charge even one fill. Which we thought, okay, that's a perfectly reasonable thing to do. They handed us a certain number of doses. We encouraged all our staff to get vaccinated. And while there is always a temptation, I'll charge you this, we did stick to the rules, and we did see this actually as good for our economic situation. Us personally, at a very micro level, we thought it was very good. So we went ahead and did it. I mean, there was a little bit of a manpower cost, but frankly, not a great manpower cost. And just knowing in a very small micro way, in the context of Zulekha Hospital, how simple it can be to start the vaccination rollout, I think it is not a hard thing. It is not a very hard thing to do. Yes, it's a logistics challenge, somewhat. But, once you get going, it's amazing how much speed that can catch.
There's so much that has to still be done in this, and I think without a doubt everybody would agree with that. Talk to me a little bit about, the need for perhaps more cooperation between governments and the private sector, and particularly when we come to a time of crisis. How can they work better together?
I think, the government has its agenda, which is, broadly speaking, any government's agenda, I believe, broadly speaking, is to make sure that their policies benefit the maximum number of people. Our agenda, of course, as a business, as a corporation, is to make sure that we maximize our profits. But because we are in healthcare, that means the delivery of good healthcare. Now, there are two concentric circles. We do meet at a vital place here, which is good health. The issue then being, what is the cost of good health? I think as long as that proposition is reasonable at both ends, and that the government recognizes that this is something that we do at a cost, while not giving in to us completely, which I understand, you do have to bring in some controls, but also realizing what our genuine costs and what our genuine concerns are. And then we realizing as a healthcare institution that in a time of crisis, the government's policy is really to reach out to the largest number of people. If we facilitate that, and they, don't and facilitate, and they make sure that, this is not a total losing proposition for us, we can go a long way towards working with the government. In the short term, that does mean that businesses do have to take on a little bit of a load. I mean, by that I mean a financial load.
Yes,
there is a short-term cost and consequence, but you do have to look at that cost and consequence in the context of the broader agenda. And as long as we know, as businesses, as long as we know that the government is with us on those broader concerns, we'll be okay.
Now, let's talk about the financing and talk about investment, because healthcare it's expensive. It's expensive for me. It's expensive for every person in the world. And yes, it's an investment in our well-being, and we have to be healthy to live a productive life. But it's the services too, and all of the great talent that you have to pull together, the research, the development, all of that. So it's hugely expensive right around. I have a question here from William in the UK. How can healthcare organizations invest in future preparedness, I suppose, to deal with any health crisis that might arise, like a pandemic? Because I've heard very many people in the healthcare sector and even beyond say that this is not going to be the last. We have to be ready for the future and what might happen.
So here's one of my concerns here is that, every crisis is different. Now, if you look at HIV, which was kind of like a healthcare crisis of the 1980s. That was a very different crisis from what this crisis has been. This has been a plain and simple, it has been a respiratory disease, but it hasn't been plain, it hasn't been simple, it hasn't been flu-like. For some people, it's gone, as many diseases do. For some others, no, it's been catastrophic. So I just want to say that we need to make sure that we have the financial resources with which to ramp up, because every crisis will be different. Yes, this is not the last crisis we have, but will the next crisis be a respiratory disease crisis? Will we need more ventilators? Will we need more PPE? Will we need more? What we need really will depend on the type of healthcare crisis that comes along. So I, unfortunately, also, this has been a little bit of a head scratcher to me. I wish I had 5 sentences with which I could tell you how the next preparedness will be, but I myself wonder what we would have to do for the next crisis. This is a very, both in description, a surprisingly simple disease, and yet in dealing with a surprisingly complicated disease to deal with. Really, almost everybody has been on their own. By that, I want to tell you that, 2 people very similar in size, shape, build, comorbidities come in, one person this passes through with surprising ease, and the other struggles very surprisingly also with it. So we really haven't known. And
it's tough. I think it's very tough. And as you
yes,
say,
exactly. So one of the things I want to just say here is, every disease, every one of these types of disease. Now, when I say, for example, that COVID-19 is flu-like, that is a deceptively simple description for a disease that actually is very complicated and surprisingly in bits both easy and complicated. And so I don't really know what the next disease will look like. I mean, we do know a couple of things though. We see the last 3 or 4 significant worldwide diseases that have emerged, like infectious diseases that have emerged. We know they come from animals. We know they come from a close proximity, a growing closer proximity between our fellow species and us as human beings. We know clearly we're doing much more harm as human beings to the earth than we really should be doing. We have crossed our limits, and I think some of those boundary crossing activities are now kind of coming back to haunt us. So we do know that. I'm not, again, I wish I knew better, but I'm not an environmentalist, and I'm also not an infectious disease specialist. So it's really hard for me to say, how it's going to be. But I do want to say a couple of things. One, I think it's very important for government regulation to, also look at the concerns of healthcare players. You have obviously have a lot of government regulation coming in. One of the things that I would like to say we've struggled with is trying to understand where the government will stand a month from now or 2 months from now, or what regulatory bodies will do in the next 2 or 3 months, how this disease will mutate, because it's not just about healthcare. It's about, for example, with COVID, it has been about travel restrictions. It's been about who's been able to come into the country. It's about, how strictly masking policies are instituted. All those things come back and, they land up in our emergency room.
Yes, indeed. And that's a nice way to actually close this off here. It is something that we're all responsible. We've all got to do something. So just before we just go, talk to me in terms of what you have managed to do. And indeed, that was a question I wanted to ask you, and it also comes in for Shava Sharma as well here in Dubai. What are the initiatives that you as a hospital have actually managed to put in place to do your bit? And I know CSR is so important to the work you do, but to make sure that you can help contain this. So if you could give us a very quick 30-second answer on that, and then we'll have to say goodbye.
So one of the things that we've done is really take the information we have as a healthcare facility, and a lot of that information, of course, is out there, but, really talking about hand hygiene, talking about masking, talking about mental health, and trying to keep you cool through a time, frankly, that is very difficult to keep anything, least of all your cool. And really talking through this this disease, because we don't know. We know so much more now than we did a year ago. We know, and we'll know so much more in another year. So one of our CSR activities has been to impart information, to kind of manage all the other diseases. Like, okay, so there's at the heart of this is the issue with COVID, and then there are subsequently so many other issues around it, which we've tried to our best to manage.
Yes, indeed, and I think it is. It's about being flexible. It's about creative thinking. It's about bringing all your people together, and I guess keeping everybody motivated. I really want to thank you, Zanubia. We don't have time.
One last thing to say. So when you say what has Zulekha Hospital done and what have you done, I've told you what Zulekha Hospital has done. Let me tell you what I've done through this whole pandemic. I've managed to hang on to my sanity by a bare thread.
I want a lovely way to put it. I think that's it. And it is about each one of us getting through, because as a leader too, you have to make sure that you stay sane, that you stay calm, and that's what your staff is going to expect from you and what your patients and everybody else will. So keep up the good work.
Thank you.
So
Thank
happy
you.
for the time to
Thank
join
you for
us.
this session.
And well done. So that was Zanubia Shams. Thank you so much. We were
Thank you.
very happy to have you. Again, stay with ABLF. We'll be right back.